Welcome, everyone, and thank you for taking time to share your thoughts and your experiences with us. We're here today to talk about COVID-19. But before we get started, why don't you tell us who you are and a little bit about what you do, Dr. Aponte?
I'm sorry, Michelle, I didn't hear you.
I said, so we're going to get started, but I'd like for you to introduce yourself. Tell us a little bit about who you are and what you do.
All right. So hello, everyone who is listening or who is watching. My name is Dr. Aponte Camacho. I am a general practitioner, and I am self-employed because I own a clinical practice here in Orlando, Florida.
All right. How long have you been in practice, Dr. Aponte?
I have been 10 years already.
All right.
Between Puerto Rico and Florida. 5 years in Puerto Rico, 5 years in Florida.
All right. So, well, welcome to Central Florida. We're certainly happy to have your practice here.
Thank
All right,
you.
so our topic today is pretty much about COVID-19. So let me ask you, how has the COVID-19 pandemic affected your practice?
Well, it has really affected it a lot because we recently opened. I would basically say we opened like around 6-7 months ago, and we were in the verge of hiking up with building up the practice, and all of a sudden with this COVID-19, definitely our inflow of patients went down.
Okay.
Yes.
Have you had to make changes due to COVID?
Oh, yes.
You've made changes?
Yes, we had to do some changes. I mean, it's not that we have a lot of employees at the moment, but we have our front desk person, which is our patient coordinator, and we had to cut off her hours. We had to reduce her hours. And of course, we had to make some adjustments here at the office, cutting down some expenses, for example, utilities like the electricity. When I am the one right now at the front desk, I'm doing as a patient coordinator, doing also as a physician.
Aww.
Yes, because I had to cut out hours to my front desk employee. And when I'm not here, when I'm all alone, what I do is that you see me turning off some lights here and there. So where I'm at, I just use my utility. Basically that, yeah, in order to cut down some expense.
All right, so you're a fairly new practice, and COVID-19 has really made you the all, do-all, know-all, be-all person in the office, right?
Yes, exactly.
All right.
Basically, yes.
All right. So what do you do now to maintain income? Like, are you scheduling your patients differently? Give us some idea of how, what you've done to help maintain income into the office.
Well, the good thing about COVID-19 is the introduction of the telehealth, although telehealth has been in the market for a while, but it has not widely been used. So basically this has in a certain way helped practices to virtually see the patients using technology. And that's what we have been doing. We have been seeing patients by telehealth. And it's a way to avoid the spread of this, very contagious virus, okay? We do still see patients in the office, but of course we have a guideline and we have a sign outside our front door to make sure, the patient does not have any symptoms. And if they do, it's not that we're not gonna see them, but we will see them outside in order to prevent the spread inside the office, try to keep the office virus free.
Oh, perfect. All right, so you've let me see if I'm understanding. So you have put certain guidelines into place, meaning that if patients are not comfortable coming into the office, you utilize technology, and it's a good thing that we have technology. So you
That's right.
utilize the telehealth technology in order to be able to still service your patients. And if they are comfortable coming to the office, you still accommodate them, but maybe you do things like check their temperature or make sure that there's hand sanitizer or whatever those guidelines that.
Exactly. Basically, what we do, we request the patients to, we have our door open in order to come into the office. So nobody has to be touching the handles, only the ones in the front door. And we tell them, all right, I need you to go to the restroom and wash your hands, and then come and sign in and fill out a questionnaire related to COVID-19 symptoms. If they have traveled outside the United States or where endemic areas were first detected, if they have any symptoms, and if they have been in contact with anybody with coronavirus symptoms. And then after we see each patient, what we do, we sanitize the areas where the patient was in.
Excellent, excellent. Well, that certainly would make me feel a lot more comfortable knowing that your office is practicing.
Oh yeah, definitely. Another thing that we have here is that they have to come in at least with a mask. I mean, they don't have to come in with gloves, but we require a mask, definitely.
Okay.
Yes.
So that's how COVID kind of has affected the way you guys have had to do business. But when you look at the bigger scheme of things, how do you think COVID has affected healthcare in general?
It has affected it a lot, because patients, due to the fear of getting contagious, getting the virus itself, people have stopped going to see their doctors. I mean, but patients still need to be seen by physicians, either because of many of them has chronic conditions such as diabetes, hypertension, end-stage renal disease. So these patients do require continuous treatment and monitoring. So it's very important that patients do seek their primary care physicians. Unfortunately, there are some of them, they have closed. I guess they were not prepared, or they didn't think of, doing what I did, telehealth. The good thing about the telehealth is that at the beginning of this situation, I think it's on, that there's a waiver of using technology in order to communicate with your patients. It doesn't have to be through a telehealth mechanism where it is HIPAA compliant. So they waive that HIPAA compliancy in order to communicate with patients, which is it's a good start for anyone who is starting or who doesn't have the telehealth platform.
Absolutely, absolutely. So there are various ways that the government has made sure that doctors in private practice, such as yourself, are able to communicate with their patients. So they can do it just plain telephone, right?
Exactly.
Or they could do it via some kind of audio visual type thing, like Facebook or Zoom or FaceTime or whatever.
FaceTime or even WhatsApp. I mean, at the beginning I've been using WhatsApp until I finally got a HIPAA compliant platform.
Okay.
But that's the one I used at the beginning. I mean, some way or another, I had to see my patients.
Absolutely, absolutely. And that's the sure sign of a doctor who cares. So you mentioned about patients having chronic care conditions, and telehealth really is a platform that, even I think maybe after the whole pandemic thing, it might be a good platform for doctors to continue, because they can schedule different types of appointments without having the patients come into the office.
That's correct.
I'm happy to hear that you have embraced technology, and I'm sure that with your patient population, you have the millennials who love technology, so that should absolutely help, right? Okay.
It's amazing. It's very weird because the millennials, you would think the millennials would use it.
Mhm.
They're the least ones to using it right now, to be honest.
Really?
Yes, actually, I'm having more patients, more elderly, more the baby boomers using this technology, you know, because they do have chronic conditions.
Right.
These patients, not 65 years old and older, they have chronic conditions and they have to take care of themselves. So they have been more utilizing the telehealth, I would say, than the millennials. The millennials are like, oh, okay, yeah, you know,
If I have to
whatever.
see you, we can do it.
Exactly, we can do it. You know, we got the world on our hands.
Well, I'm glad that you brought that point out. Baby boomers, we've had to learn. We've had to
Yes,
learn a lot. So that's good. I mean, I see a positive thing. You know, sometimes you have to find the positive in the negative, and I think telehealth
that's
might
correct.
be that positive in this really scary time of pandemic. But if you had to look back, what would you have liked to have seen done differently? Whether it's by the healthcare industry or the government or what, is there anything that, you know, in hindsight, because we're always better at looking back than looking forward, in
Correct.
hindsight, what would you have liked to have seen done differently, if anything?
I would have the government. I would say I pinpoint the government responsible for this because I would say that if they would have taken very seriously this issue in January by initially closing, I would have closed maybe 2 weeks or a month because independently the economy has definitely dropped down. And because I hear a lot of economists, I'm not an economist myself, so I don't know anything about economy. Um, I've heard that the economists would say no, but and the economy would have collapsed. But I mean, it's still collapsing even after all this time. And I would say if they would have been very strict in making sure no people coming in from Europe where this is all started would have prevented a lot of the spread in the United States. And of course, people in the United States were not prepared, to be honest. We have this thought that, United States is safe, it's a safe place, it's a safe country. We're not gonna get anything what happens in the third world countries. And no, hey, this is something that has taught us that, you know what, we can catch anything that comes from anywhere in the world
Exactly.
because we are human beings and we are
Exactly.
susceptible to organisms, to viruses, to bacteria, to parasites, to different organisms that doesn't live in our bodies. So basically, this has taught us a lesson that United States is not uh, protected.
We're not immune to it, right? We're not immune
It's
to
not
it.
exactly. We are prone to anything.
Right, right,
Definitely.
right.
Yeah, but
Okay.
I would have had the government to be more strict on the incoming flights, outgoing flights, and of course being prepared with all the test kits. Because if you saw that in the world, there was a quick spreading. United States has all the resources to be prepared. Yeah.
I understand. I understand. Okay. One final question. Since you are relatively new,
Mm-hmm.
opening your practice, I mean, you're practicing as a doctor for 10 years and more, but as far as opening your practice, you're practice is relatively new. If you had an audience of new doctors who, well, I won't say new, but if you had an audience of doctors who were thinking about opening a practice, what advice would you give them? Like, would it be positive, cautious? What advice would you give someone who's thinking about opening a practice?
Well, Michelle, I thank you for that question. First of all, is I would encourage you, anybody, not to fear. I mean, fear is something that stop you from getting, fulfilling your dreams. I mean, the only way to fulfill your dreams is going towards it, looking towards it, and focusing your sight into that. I mean, you're going to find obstacles, you're going to be learning, you're going to have some ups and downs, and you're going to be learning in the process, but it doesn't mean you can't do it. Yes, you can. Nothing is impossible in this life if you don't pursue it. I mean, and fear does not let you pursue anything. So overcome your fears of what if this happens? What if it doesn't succeed? I mean, if it doesn't succeed, okay, but you tried it. It's not that you didn't try it. And success comes from failures. So if you fail on one time, doesn't mean you're not gonna succeed in the future. You know what you have to do, and what you have to do is amend from your failures in order to succeed and prevail.
All right, all right. Wow, I'm Dr. Aponte. I'm so happy to have had the opportunity to be able to get into your head and share some of your thoughts and experience with us. We certainly appreciate your dedication to your patients and to your profession. Healthcare is, it's a profession where it really takes strong, dedicated people, and you are one of our heroes. So we want to thank you for the pursuit of your profession and for the caring that you give to your patients. I also want to thank you for spending time with us today and talking with us. And if there's anything else you want to say in closing, that would be fine. If not, then I guess we will talk soon.
Thank you, Michelle. Thank you for inviting me. And last thing I want to say is that one thing that I do is I believe in God. Some people don't believe in God. I respect that. But one of my successes is because I have my confidence in God.
All right. Thank you so much. You have a great day, and we'll certainly be talking soon.